About 30% of the pneumonia patients require ICU care. Hello, I am Dr. Manish Garg. I am a pulmonologist and I am Associate Director and Unit Head of Respiratory Medicine at Max Hospital, Dwarka. Any patient with the lung conditions, most of the times you will get to know by the doctor that they require ICU care. When do we need ICU care in the patients with the lung conditions? We can divide it primarily into the conditions related to lungs per se, to the conditions of the airways and to the conditions of the chest wall. And the out of the chest, the conditions associated with the brain and our sensorium. Any patient who is not in his senses and is not breathing needs monitoring and needs support for the breathing, and they have to be in the ICU. And regarding the conditions related to the chest, any condition in which there is accumulation of the fluid in the chest wall, patient will not be able to breathe and he will remain to be in the ICU. Conditions in which our airways are involved, it can be asthma, it can be COPD, it can be mucus that gets plugged in the airways and that does not give the way to the air to pass in. It will lead to respiratory distress and patient will need to be in the ICU. And any condition related to the lung in which it can be pneumonia, it can be pulmonary hemorrhage, it can be tuberculosis. In all these conditions, when the patient is not able to, two fundamental aspects, not able to maintain his oxygen levels and not able to wash out the carbon dioxide, he will need ICU care. And ICU care does not mean ventilator care. It includes ventilator care, but any patient who needs monitoring and who needs support, either in the form of ventilator or in the form of NIV or BiPAPs, they require to be in the ICUs. Patients with different lung conditions, they need ICU care. Discuss it with your doctor, discuss it with your ICU teams, discuss it with your families also. If you have questions, discuss with them and you will get answers, because patients in ICU, they do heal up. They improve, they go back to wards, they go back home and stay healthy for their life. Be hopeful and stay put. Thank you.